Paracetamol has an antipyretic and analgesic effect. Used in children from 3 months to 12 years as antipyretic to reduce elevated body temperature against the background of colds, flu, and childhood infectious diseases, including chickenpox, mumps, measles, rubella, scarlet fever. Anesthetic for toothache, including teething, headache, ear pain with otitis media and sore throat. For children of the second, third month of life, a single dose is possible to reduce the temperature after vaccination. If the temperature does not decrease, a doctor's consultation is necessary. How to take, course of administration and dosage. Only for oral administration with plenty of liquid 1 to 2 hours after a meal. Do not exceed the indicated dose. The smallest dose necessary to achieve the effect shall be taken. The interval between doses shall be at least 4 hours. The drug shall not be taken simultaneously with other paracetamol-containing drugs. Children aged 2 months to 3 months. For the purpose of symptomatic relief of post-vaccination reactions, a single dose is 10 to 15 mg per kilogram. Apply 1 to 2 times a day, with an interval of at least 4 hours. If fever persists after taking the second dose of the drug, you should consult a doctor. For all other indications, the use of the drug in patients of this age category is only on the recommendation of a doctor. Children aged 3 months to 12 years, the maximum daily dose is 60 mg per kilogram, which is divided into several doses of 10 to 15 mg per kilogram. Apply one single dose 3 to 4 times a day with an interval of at least 4 hours. Take no more than 4 single doses in 24 hours. Do not exceed the indicated dose. The maximum duration of the drug without consulting a doctor is 3 days. If you need to continue taking the drug for more than 3 days, you need to consult a doctor. Do not exceed the recommended dose. In the absence of a therapeutic effect, a doctor's consultation is required. Contraindications: hypersensitivity to paracetamol or any other component of the drug in history, age less than 2 months, severe violations of the liver and kidneys. Special instructions: with ongoing febrile syndrome against the background of the use of paracetamol for more than 3 days and pain for more than 5 days, a doctor's consultation is required. The risk of developing liver damage increases in patients with alcoholic hepatosis. During long-term treatment, it is necessary to control the picture of peripheral blood and the functional state of the liver. Possible side effects: like all medicines, paracetamol can cause side effects, although not everybody gets them. The side effects below may sometimes happen. If you or your child have an allergic reaction to this medicine, see a doctor straight away. An allergic reaction may include skin rash, flaking skin, boils, sore lips and mouth, swelling of your face, fever, sudden wheezing, fluttering or tightness of the chest or collapse.